In the last video, we spoke about the provider's perspective, but there's someone else in the room, so let's talk about that patient perspective. Um, if doctors are feeling stressed and overwhelmed, well, patients usually feel that too. Where is it that patients are coming from? With the understanding, of course, that everyone is a little different, but we can see some commonalities. One, just our socialization. Just like doctors, we have been socialized to think about the medical world in a certain way. Part of this comes from personal experiences. We go to the pediatrician as children, perhaps, or maybe we don't because our families have issues with doctors or are concerned about expenses. We may have watched family and friends go to the doctor and talk about those experiences, visiting loved ones in nursing homes. All of these things will affect how we think about medicine, our own experiences. But as we explore that first week in class, there's also the mass media, because for many of us, that's a major source of knowledge. That's our curriculum. And really, there are problems with that as we identified. But we have to understand that we bring some of those expectations into our interactions with medical professionals. What are other things? So we can have that personal experience. This has to do with if you're, healthy, what kinds of experiences you've had versus if, you have chronic illnesses. This may also change how you interact with the medical system and the feelings you have going in. Gender may affect your perception. Men tend to be less likely than women to seek medical treatment in the US. And, women may feel more likely that they will not be believed, as those can be past experiences you have. Culture can play in. So, what is your philosophical approach? If we think of a biomedical or an ethnomedical approach, and we'll be talking about these terms a little later. Age. Older adults may have different attitudes towards doctors and medical professionals, having grown up in an age when fewer people questioned doctors' authority. They may also find, though, that they are not taken as seriously, and there are additional stresses that can take place with that. Race, we will be talking about this a great deal next week when we're talking about inequality in the healthcare setting. But when you bring with you the legacy of white supremacist power structure, there are all sorts of things that happen psychologically, physically, that affect your health, and those are a result of this system in which you live, in which we all live, and that those come in to that examination room with you, not just on the part of the provider, as we discussed in the last video, but your own as well. You carry that with you. Class. When we look at this and we're saying, well, what are your anxieties around the economics of healthcare, how much this will cost? This is going to affect how you think about medicine. And also, region of origin. Where are you from? Another country, another part of the country, another part of the state. All of these can affect how you think about this relationship and the medical interaction. Another thing we think of is a cognitive schema, and how we think about medicine in general. So some people approach medicine with an overall paternalistic schema. They see the doctor as an authority figure, and you need to listen to this doctor. They have the authority. You have to obey them and not challenge them. And underneath this is an idea that, doctors have the patient's best interest at heart, and they're, more knowledgeable, and thus they should be more dominant. Patients who have this type of schema are satisfied with doctors who behave in manners that comply with it. It's important to recognize this. This may not be the way you would like to interact with a medical professional, but there are some people who do, who find an interaction with a physician where the physician wants to know, your thoughts about what we should do, to be really unsettling. So recognizing that there are preferences here as well on the part of patients. Another model is consumeristic, where in this schema, these kinds of patients are more likely to take an active role in communicating with their doctors, and they expect less emphasis to be placed on the doctor's authority or status. They look for a greater degree of equality and exchange of information. It's also a business transaction. And the internet has really made this model far more prevalent because there's more medical knowledge available to more people, although there's a real question about how much we can trust some of that information. Patients with this kind of schema are more likely to challenge physicians, and they'll be angered by physicians who behave in that paternalistic model. And it's worth thinking about what the pros and cons are of each of these models and which ones you really prefer as an individual, and then which one might physicians prefer and why. Another thing that we have to think about is the patient experience of this situation. What's clear in terms of the dynamics in the provider-patient interaction is that it's the patient who is saddled with uncertainty. It's the patient who's ill, and thus the patient has anxiety around their illness, has pain, and people handle illness in different ways, and they handle diagnoses in different ways. Some people find a diagnosis itself to be actually a relief, while other people find it more upsetting. It could also, be a difference of what that diagnosis is. You might be relieved to discover that, your chest pain is, acid reflux, but upset to learn that it's lung cancer. So a diagnosis has different weights, obviously, depending on what it is. But there are also, these power differentials that have to do with the knowledge differentials between the provider and the patient. The patient also has their own needs and goals. Sometimes patients are going in to seek, symptom relief, but they could also be going in for validation of their concerns, being told that they're not, losing their mind. This is real. This is happening. Patients may also come to a healthcare provider to alleviate fear about possible diagnoses. And sometimes even patients will use a physician as a kind of confessor about longstanding fears and concerns. In these exchanges, patients may also look for a healthcare provider to give emotional support, reassurance, and interpersonal warmth. Those can be pretty high expectations to bring into a room when the other person is feeling all of those things we talked about in the previous video. So when those expectations aren't met, they can make a working relationship between a patient and provider quite difficult.